Welcome to Prep and Play, where we have conversations about safer sexual pleasure. This podcast is dedicated to empowering listeners through open, honest discussions surrounding keeping our minds, bodies, and spirits healthy while being sexually active. My name is Danielle, and I'm the Rural Outreach Specialist for AIDS Alabama South, and today I have with me...
My name is Kaitlyn Burkett. I'm the Prevention, Education, and Outreach Coordinator at AIDS Alabama South.
And today we'll be discussing pre-exposure prophylaxis, otherwise known as PrEP, for HIV prevention. And if any of you are noticing now, our title is called Prep and Play, and this is where we got that little name from. So PrEP is a prevention strategy for HIV, and today we're going to be talking about what PrEP is, the different types of PrEP and their efficacy, how to use PrEP effectively, and addressing some common questions and misconceptions about PrEP. So Kaitlyn, tell me, what is PrEP?
So PrEP is an HIV prevention strategy where HIV-negative individuals take anti-HIV medications before coming into contact with HIV to reduce their risk of becoming infected. When taken properly, it is over 99% effective at preventing an HIV infection if you are exposed to the virus.
Wow. Thanks for that. So PrEP works a little bit by interfering with the virus's ability to replicate and establish an infection. I know when we were doing the HIV 101 episode, we did go a little bit over the life cycle of HIV and how different medications go in to prevent that. And it's important to note that PrEP is some of those same medications, just taken by individuals who are HIV negative.
So yes, it started as a once daily pill that was proven to be over 99% effective at preventing HIV. So we like to refer to PrEP as a birth control strategy for HIV. Today, we also have a 2-month injectable. So if you're not very good at taking those daily pills, 2-month injectable, you'd have to come to the clinic 6 times a year to get your injection. We're very hopeful, too, that there is a 6-month injectable on its way. It's in some clinical trials.
I actually do think that is going to be released this summer for sure.
Ooh, that's exciting.
But that's a conversation that we'll have with another human who I'm trying to bring on this podcast. But yeah, so thanks for that. So some people who should consider PrEP include individuals who are at a high risk for HIV. That's very vague, but I would say specifically if a person has a partner who is living with HIV, they can get on PrEP for an extra level of protection against the virus. People who inject drugs, especially those who are sharing injection drug use equipment. I always recommend not injecting drugs, but if you're going to do it, please use clean injection equipment and get on PrEP. And then also people with multiple sex partners. If you're going out and having sex with people before asking them when the last time they got tested was, PrEP is probably for you. So let's go over a little bit some of the types of PrEP and their efficacy. You want to tell me about Truvada?
So Truvada was the first PrEP medication approved by the FDA. We refer to it as TDF and FTC.
Yeah, we use those letters because these medication names are super long and impossible to pronounce.
So studies show approximately 99% efficacy in preventing HIV transmission when taken consistently as prescribed. Considerations might include potential side effects, e.g. kidney function monitoring tests are recommended while taking this medication, and the need for regular follow-ups.
And then we also have Descovy, which is a newer PrEP option. It combines TAF, which is a version of that first drug, with FTC. It has a similar high efficacy as Truvada, with some studies indicating that it might have slightly better kidney and bone safety guidelines. So generally, Descovy is preferred for individuals who might be at risk of kidney issues or bone density loss. The only caveat with Descovy is that it is only approved for people who are assigned a male at birth. I cannot take Descovy, unfortunately. It's a smaller pill as well, so that's why it's unfortunate to me.
COVID's always getting in the way.
Yeah, actually, COVID is always getting in the way.
Descovy was in clinical trials when COVID came around, So they had completed the efficacy tests and trials in populations assigned male at birth, but they never finished the populations of female assigned at birth before COVID hit. So everything shut down and they just haven't finished those yet.
Yep, maybe one day. And then last but certainly not least, we have Apretude, which is our long-acting PrEP. Apretude is a long-acting injectable form of PrEP, also known as cabotegravir, which is the only one of these I can pronounce. And it also doesn't have little letters, so we're grateful for that. Early results of Apretude suggest that it may offer similar or higher levels of protection compared to daily oral PrEP. I would say this is probably most likely just due to adherence in general. Like, there is very little user error with Apretude. As Kaitlyn was saying earlier, we like to consider PrEP as birth control for HIV prevention. But the thing about birth control is, like, if it's the pill, there's always that user error where someone can forget to take it at the wrong time, take too many and be missing one at the end of the month. The same goes with PrEP. With Apretude, the only real user task is to schedule the appointment every 2 months. From there, it's the provider's job.
And we make sure you have an appointment to come back before you leave.
Yeah, we make sure people come to their PrEP follow-ups.
And I can attest to not taking medications regularly. I forgot my morning drugs this morning.
Yeah.
Luckily, I take my PrEP at night. Night pills, I can't go to sleep without the other ones.
That's a good way to do it. So again, Apretude provides the advantage of not needing daily adherence, but the consideration here is that it does involve regular injections. Something new that I learned is that if somebody has silicone implants in their butt, it is a lot harder to be able to use Apretude, just because the shot does go in the glute muscles, and pretty much unless the same doctor who placed the implants is doing the injection, it's very hard to know where those implants begin and end.
So how do we use PrEP effectively? Adherence. The importance of taking PrEP consistently and as prescribed to maintain high efficacy. So basically, we just have to maintain a certain level of those drugs within your system to maintain that efficacy and ability to prevent an infection to HIV.
Yeah, and that's a good point, that we only have to maintain a certain level of that. So when taken as prescribed perfectly every day, PrEP is over 99% effective, and that's including those daily pills. But there are studies showing now that at least 4 pills per week still provides some efficacy. So if somebody forgets to take their medication, their PrEP, 3 days out of the week, they are still roughly 80% protected against HIV.
I didn't know that. That's good to know.
Yeah, and you were talking about some strategies, like you always remember to take your night meds, so you take your PrEP at night, right?
Absolutely. I mean, I can't sleep without those other drugs, so I never forget my night pills. Mm-hmm. Mornings are another thing. I don't agree with mornings.
Does anybody agree with mornings? Some other strategies include setting reminders. I know when I was on birth control pills, I had a reminder in my phone every day to remind me to take my birth control pill, and now I can do that for PrEP as well. And also having regular check-ins with healthcare providers. If I'm going to see my doctor regularly and I'm having issues with adherence, I can tell my doctor, and maybe there's something that can be better. Like taking this giant Truvada pill every day is not ideal. There's something else I can do here.
You haven't scheduled the injection yet?
Insurance won't cover it, Kate.
Oh, no. That is the only setback that we are having with getting people on it. It's those pesky insurance companies.
Yeah. And then also, checking in with your healthcare provider is super good for regular monitoring. While on any medication, you want to be having routine check-ins, but specifically with PrEP and specifically with oral PrEP, you want to be monitoring your kidney function, your HIV status, because there are rare cases where somebody seroconverts, which is they go from being HIV negative to HIV positive while on PrEP. And I do say very rare, and in most of those instances, there has either been a major issue with adherence or the exposure was prior to them being on PrEP. and they originally got tested negative in that incubation period. And then the PrEP kept their viral levels so low that it didn't show up till later. So you want to be checking your kidney function, your HIV status, and potential side effects. Some of these medications can be particularly hard on the stomach. I know one of the main complaints with Truvada is tummy upset, like nausea, that sort of thing. And then also, it can be important to go to counseling and get support to address any concerns or issues that pop up. I think we're at a great day and age now where people are proud to be on PrEP. We have little stickers, talking about proud to PrEP and all that. And taking care of your sexual health has to become empowering rather than anything else.
I totally agree with that. But if you don't feel like PrEP is for you, at least commit to regular testing.
All right, and now let's go over a couple common misconceptions and questions. So, Kaitlyn, does PrEP replace condoms?
PrEP does not replace condoms. So PrEP is an HIV prevention strategy. It does not prevent childbirth. It does also not prevent any of your other STIs.
And that is super important because we are seeing some sexually transmitted infections on the rise, specifically because of PrEP, because people are taking PrEP and they're like, oh, I'm protected against HIV, but you're not protected against gonorrhea, chlamydia, syphilis, trichomoniasis, hep C. You're not protected against any of those other things.
That was quite an exhausting list. Good job.
I don't know why I did it so fast. So if I start taking PrEP, do I have to take PrEP forever?
No, you only need to take it when you need it. So if you get into a long-term relationship and you are both maintaining monogamous relationship status, you can stop taking PrEP. Or you just stop having sex for a period of time. You can stop taking it then too. I would also recommend it for our healthcare providers too. If you have regular interactions with blood, there's always a risk of that too. But I mean, we have to take those bloodborne pathogen trainings every 6 months, 9 months, every year, but accidents still do occur. So if you're working in healthcare, it's not a bad idea.
Awesome. Ooh, so Kaitlyn, I've been hearing about PrEP, but I mean, I'm not a gay man, so I'm not really at risk for HIV, am I?
HIV does not just affect gay men. HIV does not discriminate.
Thank you for that. We always talk about how it is the human immunodeficiency virus, which means everybody in the human race is eligible. So just on side effects and safety, again, so some of the common side effects include nausea, headache, and those are easily managed. I would personally rather suffer through a couple days of nausea when I start taking a medication than suffering 3 years of HIV treatment.
Just 3 years? Treatment's for the rest of your life.
Suffering through years. But yeah, suffering through the rest of my life of HIV treatment. So, based on the current research, these medications are effective and safe long term. There are some possible issues with kidney and bone density, but even still, those slight risks seem to be outweighing the benefits by far. It's worth noting that these are, again, we like to compare them to birth control a lot. There are birth controls, specifically when I'm thinking of the Depo shot, which is linked to bone density, and that's not even over years. That's you got a couple years you can take that without having bone density issues, whereas these PrEP medications appear to be safe and effective for years and years. So just to recap, we explained a little bit about what PrEP is, pre-exposure prophylaxis, some different types of PrEP, including Truvada, Descovy, which is only approved for people assigned male at birth, and Apretude, which is our long-acting injectable. We talked about how to use PrEP effectively. Kaitlyn gave us some great strategies for adherence. And we addressed some common misconceptions. So I just want to emphasize the importance of just getting in touch with your healthcare provider to see if PrEP might be suitable for you so that you can receive some proper guidance there.
Absolutely.
PrEP can be for everybody who needs it. So you can find more resources and support for PrEP either at your local health department, or if you are in the Mobile area, you can visit Shell Health at 4321 Downtown or Loop North. We are a full-service PrEP clinic. And then hopefully on our next episode, we'll get to discuss post-exposure prophylaxis, which comes after pre-exposure. Anyway, thank you, Kaitlyn.
You're very welcome. Thanks for having me.
And thank you to everyone listening. Goodbye.